Doctors of Reddit. What was your worst, I don't think this is important, but patient? Story 1. Had a patient come into ER with some sort of spider bug bite on her hand that had progressed to a red line running up her arm. She stated she put Benadryl cream on it and it was very itchy. We continued talking and I asked if she had any allergies. Yes, Benadryl. I thought, good lord, what the heck, and I'm sure it was reflected on my face. We washed the Benadryl cream off her arm, and miraculously, it stopped itching. Reply 1. So this is the person that makes it necessary for medication commercials to say, do not take this medication if you are allergic to this medication. Reply 2. I guess sometimes this floor is made of floor really is a difficult conclusion to reach. Reply 3. I always wondered about that. I guess there had to be someone somewhere for it to be in the standard warning. Story 2. I once checked in a guy and asked him if he'd had any previous surgery. No, never. When I examined him, he had a surgical scar from just above his pubic bone to just below the sternum. What's that then? I asked. He stared down at it and said, I've never noticed that before. What the heck? Reply 1. This makes me unreasonably happy. How did that happen? Did he feel so dumb forgetting about major surgery that he just doubled down on it? Did he have surgery as a baby and just assumed everyone had one? Was his real problem that he had a black hole in his vision and couldn't see midlines? So many questions. Original poster. I don't know. I was a junior doc at the time, and my consultant didn't believe me until he spoke to the patient himself. We never found out what surgery he'd had, or why, or where. Reply 2. My money is on cocaine is a hell of a drug. Story 3. Intercepted a young woman who was just hit by a car. Her boyfriend was standing with her, freaking out. I do a basic physical exam and get a history, and make her comfortable as we wait for the ambulance to arrive. Once the ambulance arrives, they ask for the same information, except this time the boyfriend mentions he was the one who was actually hit by the car and was shielding his girlfriend's body. The entire car's windshield was cracked by the impact of his back. He was just freaking out and worried about her and was in shock and hadn't begun to feel any pain yet. Reply 1. Won't lie, I was initially deeply worried this was going to turn out like a car crash in Vancouver, WA, 20 years or so ago. One of the drivers seems to be basically fine, interacts with bystanders, chats with first responders, kinda mentions offhandedly that he'd kissed his steering wheel in the accident, but insists he feels fine. 10 minutes or so after the first ambulance arrived, and before the ME's transport wagon reached the scene, he abruptly and mid-sentence literally drops dead. Because when he hit his steering wheel, it caused splinters of bone to sprawl back into his brain, and the resultant massive trauma didn't kill him for nearly 30 minutes afterwards. So I'm super glad this apparently had a much happier ending. Hopefully, one assumes. Reply 2. Something similar to that is actually common in a specific kind of brain bleed, epidural hematoma. They hit their head, lose consciousness for a bit, wake up, and are seemingly fine. After a bit of time, they start to develop symptoms of raising intracranial pressure. Chances of dying rise tremendously with passing time. If you ever witness someone losing their consciousness after hitting their head, call an ambulance or get them to a hospital immediately. Story 4. I had a headache and a few hours later noticed that my irises were different sizes. I went reluctantly to the emergency room. Minutes after presenting myself, I had neurologists looking at me and I was rushed to get scanned. The artery about 1.5 inches below my brain had torn. The doctors were basically just waiting for me to have a stroke. I didn't, somehow. Reply 1. I have a condition that when I get a migraine, one of my pupils gets bigger than the other, but I had only heard of pupil difference being a sign of something very wrong in your brain, so the first time I saw it, I panicked. Reply 2. I had a similar thing happen. A moderate headache and then noticed blurry vision in one eye. Looked in a mirror because I thought my contact was messed up, and my one pupil was so large you couldn't see my iris. I sat in the waiting room at the ER for maybe 30 seconds before they came to get me. The people in the waiting room were looking at me like I was about to die in front of them. Maybe an hour later, they were putting an IV line in my arm when my pupils switched sizes. The one that was normal got big, and the big one shrank to a pinprick. It happened as the nurse was watching me. Let me tell you, I've never been more freaked out in my life. I was swarmed by people in about 10 seconds and rushed to get scans. And the end of the story is, no answer. They just let me go 12 hours later because nothing happened and all the scans were normal. This was about a year ago and nothing like it has happened since. It was a weird day for me. Reply 3. Not to freak you out or anything, but I have a friend who went through something similar. Then blurry vision happened again a couple years later. He wound up having very slow progressing MS. He's totally good, but if you have vision issues again, maybe bring this up as something to consider. Story 5. Me. Do you have any medical history, including things like heart attacks, strokes, high blood pressure? Patient. No, nothing ever. Me. So why do you take list of heart meds? Patient. Oh, I've had multiple cardiac arrests. Story 6. Had a male in his 50s walks into trauma to have his left thigh stitched up. Not an uncommon wound in an agricultural area. Speaking to him while stitching him up, he tells me he fell off a ladder while cutting a branch and the machete sliced him on the way down. Told him I was going to write him up for an x-ray of the entire leg just in case. He kept on saying he was fine. His knee hurt a bit, but logically that was from the fall. I agreed, but asked him to go to the x-ray department just in case. He reluctantly walked there and back. X-rays showed a helical fracture almost the entire length of his femur. Besides being a dangerous fracture, the femur is supposed to be the most painful bone to break, and he was walking around. In the end, had to show him the break to get him to sit down on a wheelchair and into the hands of orthopedics. That man's pain tolerance still impresses me. Reply 1. If a farmer comes into the hospital willingly, something is really wrong. Reply 2. My first experience with this was at a rural hospital I was doing a travel assignment at. A guy came into the ER with chest pain. Okay, sir, let's get you hooked up to some monitors. When did the pain start? While chopping wood this morning, he says. Okay, any previous surgeries? He mentions he had a bypass. Warning bells triggered. Okay. When was the date of your surgery? Last week. His sternum had ripped through the wires. He had been home from the hospital for less than 48 hours and was chopping wood. This man was walking, talking, and in a bit of discomfort as he was telling me all of this and trying to take his shirt off. He just wanted us to patch him up a bit, give him some painkillers, and send him on his way. Me. Sir, you need to go back to surgery and get some new wires put in. He was not happy about that and was grumbling about how he knew he shouldn't have listened to his wife and gone to the hospital. Farmers are the toughest people on the planet, even if it is to their own detriment. Edit. I must add that while I was completely flabbergasted by this, the other nurses, techs, physicians, and even housekeepers just shrugged and were like, not the first time we've seen that. Not even the first time this year. Story 7. I was working in an area with lots of Mennonites. A mom called into the clinic because a wheel had broken and one of the spokes had penetrated her toddler's eye. The reasons for the call was to ask if he needed to be seen by a doctor. She indicated they had removed the spoke and she knew he was going to lose the eye. So was there really a reason for him to be seen? The answer was yes. Reply. Always heard the eyes are invisible to the immune system until you injure an eye. If you injure one, both can be attacked by your own immune system, and you can end up losing the injured as well as the uninjured eye. Story 8. This 20s guy came into the hospital. He had a lot of conditions where he wouldn't make it past 40, and he currently had some infection. We kept giving him antibiotics, which helped, but not as much as we would have liked. After about a week of being in the hospital, I walk in, and I'm talking to him, and he tells me that he got a medically necessary circumcision on his last admission to the hospital. I ask if it's okay if I take a look to make sure it's healing okay. It was black with all kinds of infection. I'm just not sure how a 20s married man, or his wife, never thought to tell anyone about this for the past week. Reply. My sister works in a hospital sterilizing the medical instruments for surgery. She said one of the most common surgeries is foreskin removal due to infection. It's so important to teach your child how to clean it properly and proper hygiene in general. Story 9. I was working in the ER as a paramedic intern. An older man came in with his hand bandaged, stating he couldn't get his thumb to stop bleeding. As the nurse unwound the bandage, there was a gaping wound oozing blood from where his thumb used to be. The nurse asked him where his thumb was, and the old guy asked what day it was. The nurse said Thursday, or whatever day it was. The guy said, well, I guess the thumb went out with the trash this morning. He'd lost his thumb to his lawnmower 3 days ago, and only now was coming in. Story 10. While pregnant with me, my mom was wrapping up an OB appointment. The GYN had already left the room. Mom was gathering herself to leave and mentioned to the nurse her contacts were messing with her. She had spots in her vision. The nurse stopped and asked her to sit down. Brought back in the GYN, who had her stay and deliver me via emergency C-section. Without anyone knowing it, she had spontaneously developed preeclampsia and her blood pressure was rocketing sky high. She was dangerously close to having a seizure, and that would have been that if she hadn't mentioned the spots in her vision and just left as the appointment was over, or the nurse didn't listen. Reply: it's those last-minute moments with good nurses that can make all the difference. My dad was getting chemo for cancer. He had a favorite nurse at the clinic, but she wasn't on shift. When I got there to pick him up one day, he noticed her coming on duty as we were leaving and stopped to say hello. She was a warm person and took his hand in greeting. She happened to glance down and then stopped and pulled his hands together. As soon as she did that, the reason was obvious. His hands were completely different colors. She looked at him and said, "I think you have a blood clot in your left shoulder. You need to go straight down to whatever, I can't remember. Was it MRI? And get that scanned. Go right now. I'll call ahead and set it up." As we were leaving the chemo room, we heard her start to berate the nurse who had been looking after Dad that afternoon for not noticing. Anyway, the clot was exactly where she said it would be. If it had dislodged, it probably would have killed him instantly. They put him on blood thinners and he was fine. Well, fine from the blood clot perspective. He still had a terminal cancer diagnosis, of course. Story 11. I had to take out the remainder of this guy's teeth. He was in his 60s and told us verbally and on his health history that he didn't take any meds. So I took out his last 8 teeth, all easy extractions due to infections and periodontal disease. But I couldn't get him to stop bleeding. I asked him again if he was taking anything. I finally got the clot stabilized, but it took almost an hour, and I had to consult our oral surgeon. When he saw the oral surgeon a few months later about placing implants, he told the oral surgeon he was on BP medication and blood thinners. I refused to see him anymore after that. Story 12. Emergency radiologist here. I see plenty of people presenting with understated symptoms that turn out to be mind-blowing advanced disease. The saddest one was probably the 4-year-old boy who presented with a rigid abdomen for a few months. Was told by their pediatrician it was constipation months ago, but his parents never followed up when it didn't resolve. When I imaged his abdomen, I found his entire liver was replaced with a mass consistent with hepatoblastoma. I asked the parents why they waited so long to work it up. They said they were satisfied with the diagnosis of constipation. That one left a mark on my soul. Reply: they weren't concerned that he was constipated for months? Original poster. Precisely my thoughts. I always suspected neglect, but had to leave it up to their pediatrician for follow-up. Story 13. Did a bunion and hammer toe surgery on a lady with no allergies. New patient packet, primary care note, all had no known allergies. I always ask about metal allergy anytime I plan on putting in hardware. Surgery goes great. I'm on call for the practice and receive a phone call for the group 18 hours post-op. Her nerve block had worn off and she was in excruciating pain. Give instructions on what to do. Next morning she's in my office before I even arrive. 10 out of 10 pain, sweating profusely, blood pressure elevated, foot is massive. Clearly not faking it. Have to send her to hospital for intractable pain. Blood work indicates elevated eosinophils, but everything else normal. No blood clot or infection. Hospital convinced it's complex regional pain syndrome. I rack my brain and think of what the heck could be going on. I am only 5 months out of residency. My butt is puckering so hard. Since eosinophils elevated, ask if she is allergic to jewelry. Yeah, my tongue swelled up when I had it pierced. I had it removed the next day. She had a freaking nickel allergy. No allergist will see her to confirm, so this is all speculation, but makes sense with the hardware I used. Once the hardware is removed and exchanged for titanium, her pain resolved. There was one case in my residency of hardware allergy, 1 out of 3,000 cases I was first or second assist on. If I did not scrub into that case, I don't know if I would have figured this out so quickly. Crazy case. Now I always ask, have you ever had any reactions to jewelry? A lot of patients won't tell you about problems with jewelry and may not know they have metal allergies. Reply 1. Why do they even use hardware that contains nickel? It seems to be an increasingly common allergy and can appear out of the blue. Is there a reason why something like titanium isn't the default? Original poster. There are definitely properties of both that make one desirable over the other for certain situations. Titanium is stronger than stainless steel, which sounds great, but makes it difficult to remove the implant. Titanium also costs more and is not widely available, especially in small hospitals like mine. Interestingly, the girl that had an allergic reaction to her plates and screws during my residency had an aluminum allergy. We had used titanium alloy hardware on her. The allergist was consulted post-op. Her foot blew up in size, and she too had intractable pain and swelling, and tested her for every metal that we put in her. Crazy to think she had an aluminum allergy and did not know it. We had used titanium because she had a history of problems with jewelry and the metal on her jeans. Story 14. Had to perform an extraction. Took a detailed medical history. Patient said they were a diabetic and a hypertensive. Both a big contraindication in extractions due to uncontrollable bleeding. Unless they're meticulous about their taking their medicines and you stop the blood thinners 5 days prior to surgery, it's usually a bloodbath. I asked the well-educated 50-year-old woman a number of times if she took her diabetes medicines on time and if she does at-home rapid tests to check her blood sugar. She said she takes them every day without fail and hasn't missed a day in over 2 years. She said she's super disciplined about her health and would tell me if she hadn't taken them. I sent her in for a rapid blood sugar test anyway, as a precaution, and lo and behold, her values came back as 282 mg, almost twice as much as the normal value, so it wasn't even like she was just off the mark. I asked her to explain, and she gives a shocked expression and insisted that she took them. I ask her to physically show me her medicines instead of listing them out, and she finally says, "Oh, I don't have it right now. I make it when I need it." Make. She drinks bitter gourd juice on time every day instead of her diabetic pills because they are too big, and she 100% believed bitter gourd juice was the only medication she needs. She's a high school teacher. Story 15. One of my first patients as a medical student. We were asking her about prior medical history because she was in a wait list for an intestinal transplant, and we asked her in every possible way if she had any history, and she was like, "No, I was very healthy before this." Finally, we asked her, "Do you take any medications at home?" And she goes, "Oh, just the meds I take for the lupus." Reply 1. This, all the time. Can I take a brief medical history? Any major operations, chronic illness, regular medicines, allergies, that sort of thing? No, none of that. I'm pretty good. I notice a large scar across your chest. Did you happen to have heart surgery? Oh yes, there was the triple bypass. And the scar on your knees? Oh yeah, I had both knees done. Does that count? Oh, you probably want to know about my hip too then. Yes. But other than that, it's all fine. Oh good. So do you take any medication? Only these. Hands over a list of 20 plus medications, including heart medicines, water tablets, painkillers, inhalers, etc. Rolls eyes and screams internally. Reply 2. The best bit is when they say that they are prescribed all these and then only take some here and there when they think they need. Reply 3. My sister is a nurse and has adjusted the question for things like this. Do you have any medical conditions? Nope. Do you take any medicines? Oh sure, list stuff for diabetes, heart conditions, etc., etc. Sigh. Story 16. While I was a psychiatry resident, I did a graded 30-minute interview on front of my attending on a new patient without knowing any previous chart history. I spent 29 minutes collecting high-yield medical and psychiatric history, and since I had an extra minute to spare, decided to ask him more about his childhood. Well, it was pretty shitty after I watched my dad murder my mom and then unalive himself. Needless to say, I did not have enough time to unpack that and failed my exam. LOL. Story 17. Had a guy in his 50s who had been seeing an acupuncturist for an area of numbness and weakness traveling down his legs. He'd had 2 months of acupuncture for them with no improvement, so very reluctantly booked a routine GP appointment. At that point, he'd started to have issues with his urination too. As soon as I started speaking to him, it became obvious that the symptoms he presented with were consistent with spinal cord compression, an absolute medical emergency. We got him straight into hospital, and imaging showed cancer, with a tumor pressing onto his spinal column. Although he started treatment and steroids that day, by then it was too late. He lost the ability to walk and died a few months later from the cancer. It was enormously sad and frustrating, as that constellation of symptoms would have raised an immediate red flag with anyone with medical training. Had he come in months earlier, maybe his prognosis would have been quite different. Story 18. Everyone at my company knows the story of the patient who came in for genetic counseling, went through their whole family history with the counselor, and then concluded with, "Oh yeah, I was adopted as a baby and don't know who my birth parents are. Does that matter?" Reply: I love this. A lot of this thread is disturbing stories of people ignoring life-threatening symptoms. This is just good old-fashioned harmless stupid. Reply 2. Every time "does this run in your family" gets asked me, I have to point out I'm adopted. Story 19. My 4F at the time, mom, thought that it was weird how I could describe what I see of one part of the environment and not the other, especially because according to her, I was a happy child and didn't report any sight issue. She brings me to the doctor, afraid that I may have an intellectual disability. Turns out one of my eyes is totally blind. Story 20. As called to the ER to do a psych consult on a patient that was complaining of GI symptoms, but his story was sort of strange, and he had no overt abdominal signs or symptoms. He was complaining that he suffered from Barrett's stomach, not esophagus, and had been diagnosed by a world-famous gastroenterologist. He stated that if he could lose weight, that his GI issues would resolve. I spent some time talking with him, and other than this strange fixation on his Barrett's stomach, he seemed okay. Until he mentioned that his most recent weight loss method was to shoot himself in the thigh so that the leg would become gangrenous and eventually need to be amputated. This would allow him to lose the 20 or so pounds needed to cure his stomach ailment. The man actually had a self-inflicted gunshot wound to the thigh from several days before. I didn't actually assess the wound because I was there for a psych consult, but did immediately alert the ER staff. I was all calm and nonchalant, like, "Oh, sir, excuse me for a sec. I'm gonna pop out and let another staff member know about this so they can take a look at it for you." The ER was located in a county that employed a staff of mental health social workers to place psych patients, so I had to call one of them out while he was getting thoroughly physically assessed. I have no idea what happened to him, but I hope he's doing okay. Story 21. While I was interning in my general surgery rotation, we received a patient for an emergent exploratory laparotomy, emergent open surgery, from the ER with severe abdominal pain. ER had done an x-ray and saw that he had bowel perforation. You can see a bubble of air that collects underneath the diaphragm on a standing x-ray. The patient history we got from ER was that the patient had felt pain onset 3 days before checking into the hospital, but decided it was nothing and attempted to self-medicate with vodka for the pain until it was too unbearable. Here's the kicker. The bowel perforation was caused by acute pancreatitis. Too long to explain the how and why, which was likely due to his prior alcohol abuse. So his self-medication only worsened the state he was in. Story 22. I was an internal medicine resident who had a patient come to my clinic for persistent flu. I had never seen her before, and she was a healthy-appearing woman in her 60s. About a month before seeing me, she was seen by her PCP with persistent coughing and otherwise had no shortness of breath or other infectious symptoms, just a dry cough. She got tested for flu and was negative, but got Tamiflu just in case it was a false negative. She had a chest x-ray, which was normal. She came to me a month later because her cough persisted, despite completing her therapy. Everything sounded great. Heart, lungs, everything. To be honest, I don't usually do this, but something in my gut told me to feel for lymph nodes. I felt around and found something above her left clavicle. It was hard, round, and she was completely unaware of it. I told her it was probably a reactive lymph node, but just in case, I wanted to get an ultrasound. This cascaded into her getting a biopsy, which showed squamous cell lung cancer. A CT scan showed stage 4 lung cancer not seen on her chest x-ray, all diagnosed because of a lymph node that was almost by chance I was lucky enough to find by being thorough. I checked her chart about a year ago, and she was doing well. She got therapy and was in remission after a very long road and many obstacles. I'll never forget her or her case. Story 23. As a patient, I had a doctor tell me, "I don't think this is important." My physio had identified a mole on my back that had changed colors. Being fair-skinned and Australian, I was obviously concerned about melanoma, so I went to my doctor for a checkup. He looked at it and said, "It's nothing, don't worry." I insisted that since I'd made the effort to come in, he might as well take a biopsy and get it tested. He was reluctant, but I insisted, and he eventually removed the mole for testing. A few days later, the doctor rang and informed me that I had a very nasty malignant melanoma and needed surgery immediately, if not before. 2 days later, I was in hospital, and they removed a lump from my shoulder 3 inches across and 2 inches deep. Cancer-free now for 8 years, but if I had taken the doctor at his word of, "it's nothing," I'd most likely be dead now. Story 24. My favorite is always, "I don't have high blood pressure," or "I don't have diabetes." Okay, why are you on these meds? I had it, but now it's gone. No, sir, it's not gone. It's just being controlled by medication. Also, when you ask, "Is there anything else you'd like to discuss before we end this appointment?" they say no. And then as you're walking out the door, "Oh, doc, I forgot, I've been having chest pain for a week and trouble breathing."